Hi,
Hi, can
can you see me?
you hear me?
Yes,
I
yes, I can, I
can
can.
see you, but you're a little blurry.
Am I?
Can you
Yeah.
hear me clearly?
Oh, yeah, very clear, very clear. How are you doing? How
I'm
are you,
not
Wilona?
able to hear bits. I'm doing good, Charan. How are you?
I'm good, thank you. So, for everyone who is watching, Wilona is my senior from Father Muller Metal College, but we never met in the college. We met outside the college in a con.
Yeah, we never met in college.
Wilona, introduce yourself. What do you do? Where are you working?
Okay, so hi everybody. I am Dr. Wilona Annunciation. I am a psychiatrist. I practice in Mumbai, and so I have associated myself with two NGOs. One is Institute for Psychological Health at Thane, and the other one is Prafulta, the Center for Psychological Wellness at Andheri. So I work in these two places. In addition, I have my own mental health training company called as Catalysts, and I am a founder there. So I work with um, offering mental health support services to organizations, which includes corporates as well as other NGOs that are in the mental health space, and for working for other causes. So that's what I do.
Yeah, that's a lot.
That's a lot. Yeah, I agree.
No complaints, though.
No complaints though. No complaints.
Yes, Wilona, I chose this topic because not just textbooks, even in in personal life and real life, I'm seeing the use of cannabis has become such widespread thing. And
Absolutely.
whenever I go and tell people that it's not healthy, a lot of people come up with hypotheses, or they show me some articles or from newspapers saying that there's something called medical marijuana, which is very healthy. So they asked me to
Yes.
check my medical knowledge. So I thought we should do a talk to explain what exactly is the difference between medical marijuana and the one that is used for drug abuse. So questions for you. Can start.
Sure. Yeah.
Hey, Vilona, am I audible to you?
Yeah, now you are. I lost you for a bit. Now
Yeah.
you're clear.
So the first question is, what exactly is cannabis?
Okay. So, cannabis or weed or marijuana, which is more, the more popular way in which it is referred to, is actually the, extract from the flowering tops of the plant, which is either cannabis sativa, cannabis indica. There are different varieties of it. It's actually the flowering tops, and this is a plant that provides us with like a real huge variety of compounds, and out of that the psychoactive substance that we consider for either medicinal or recreational use is tetrahydrocannabinol, which is THC, which is what we predominantly see being used all across the world. THC is the active ingredient, and it is used in a variety of forms. Like you very well know, people choose to either smoke it up, either in the form of cigarettes, or they roll it in a paper that they use to create their own joints. Or I've seen like a few of them remove the tobacco from an already marketed cigarette from the market and mix it with the weed and then use it for smoking up. But they also use it in a variety of other forms. Um, I'm sure you've seen people talking about the cannabis butter, the cannabis oils. We also have a variety of products that are created specifically with the weed in the market. So the special brownies and a whole range of items that is catering to this requirement. In fact, when we went to Amsterdam last year, because it is legally permitted there to use marijuana, we could see a lot of shops that were selling and making it available in in very simple ways, like not just smoking, but also like oils and, soaps and different ways of making it available to people. So for us, medically, the compound that we look at is THC.
Yeah, yeah. So I think that's very clear. What are the various names? Like there are street names, right? Like a rapper. Even this drug carries a lot of street names, or stage names, or whatever you call it. What are the various names that people identify with?
So usually people call it, weed and marijuana is the most common, but they also, since the plant is the hemp plant, they can also call it hemp. They call it grass. They call it hash. They call it ganja. So a number of different names. Do you know of any other names that have been used?
People call it stuff.
Stuff. That's a very generic name, like something that they
Yeah,
use for a lot of things. So yeah,
lot of
we won't
things.
go with that.
Yeah.
Yeah,
Hashish. Yeah, I think that's
yeah.
it. I mean,
Hash. Yeah, very common.
people have their own pet names for it, I guess. So
Yeah,
we would
I'm
never know.
sure. I'm
Yeah,
sure.
yeah, yeah. So how is it used? I mean, you already mentioned about different ways of using it. Now, the two predominant ways people use it, obviously one is inhalation, another is ingestion. Inhalation is smoking up or
Right.
eating it, right? So is there any difference there
So I
between?
think when they are inhaling it as a smoke, as in, either as a vapor or as a smoke, when they're inhaling it, the feeling of getting high or getting stoned is something that they get much faster than if they are, ingesting it. Because uh, obviously, when you ingest a substance, it goes through the entire, GI system, and it has to go through the blood and everything. By the time it reaches the brain, it's a good 1.5, 2 hours. So it
Hmm.
takes that long for the effect. And I think because of that also, the expected precautions that people tend to take is they don't rush through the ingestion. They do it like very slowly and over an extended period of time, because you could very well like eat up or take in quite a quantity of cannabis before the first effect actually hits, and then suddenly you're in a really like special zone. So
Yeah,
I
yeah.
think they need to go slowly with the ingestion. um, in terms of the high that they experience, a lot of times people have told me that the high that they get by smoking is much better than the one that is by ingestion. And also that they experience a sense of, calm and out of world kind of experience. So that's sort of similar in both. um, yeah, I think this is what I would look at as the differences between the two.
Yeah, true. Because a lot of the patients who come with intoxication or a bad trip or flashbacks or whatever you call it, are the ones who have ingested it. Because when they take like one space cake or one brownie, they think like, oh, it's not hitting me yet. So they will go to the second and third because it has to
Mm,
go through
because
your
it has to go through.
liver and all of that. It will take much longer time. So suddenly it hits them and they'll have a bad trip. Even people who are presenting with delusions and hallucinations are the ones who probably have ingested than inhaled.
Inhaled.
Yeah, not that I'm promoting inhalation over ingestion, but still, because
Yeah.
words can get like very tricky. Yeah. Yeah, but this one common argument that people do with me is, but marijuana is not addictive. Like I'm not addicted. It's not addictive. What do you think? Is it addictive?
So I think there's definite potential for addiction. It's just not, it does not have a physical withdrawal reaction like we see with alcohol and tobacco. So commonly patients who have developed a dependence on alcohol and tobacco have physical symptoms of withdrawal. Like patients or people who are used to smoking constantly and are not getting access to cigarettes can tend to become very irritable, very restless. They feel uncomfortable. Sometimes they get very constipated. With alcohol, you can see that they have tremors, they have difficulty falling asleep. So insomnia is a very common complaint. They might have, again, restlessness and anxiety during that time. So I think this is what does not happen when you don't smoke up. So that gives the pseudo feeling that I'm not dependent on it. I can stop it whenever I want, because when I stop, I don't feel any problem. And this
Yeah.
is what they commonly come back and tell me also, "Ki, doc, I'm not addicted. I can stop it whenever." And I'm like, okay, then stop. That's the tough part, right? That's the tough part.
Yeah.
So I think any substance which has the potential to make you experience a very good feeling, whether it is alcohol, whether it is a sedative medication, has the potential to be abused.
Yeah.
And for us in mental health, we look at dependence not only as whether or not you're having a withdrawal reaction, but as a cluster of symptoms. You know, whether you crave for it, whether you, earlier needed a lesser quantity, now need a greater quantity, whether over a period of time you have neglected other sources of pleasure. So it's a cluster of symptoms that we look at over an extended period of time to see whether or not you are addicted to it, right? So definitely, I would say it has addictive potential.
Yeah. One shocking thing, what I'm seeing is children as early as 10 years, they're starting to use cannabis because there's a wrong concept that, cannabis is, medicinal. It has medicinal
Mm.
value, because it is legalized in so many states abroad. So they think it's medicinal. So people who have, let's just say, ADHD or is restless, have performance anxiety, let be if you're dancing for your college culturals or school culturals on the stage, they think that, smoking will help you ease in. Definitely it does, but it also has a downside to it. People don't realize that. So even kids are getting used to it. Like recently, not recently, I think 2 years back in Hyderabad, they got hold of a couple of international schools where there is drug peddling happening, and kids are like few of the most important buyers from them. So it was a
Mm.
major breakthrough news, which is extremely sad because that's already a vulnerable state. And probably these kids are coming from, we don't know, maybe dysfunctional families, broken families, and maybe they don't have, they're neglected. Not necessarily, but that is also a risk factor. I'm definitely seeing that. Um, what is your experience? I mean, how early do you see cannabis dependence uh, coming for?
So I've seen it in kids as young as 12 and 13. And this is dependence I'm talking about, not just recreational use, which might have started as early as 10 in some kids, as you are reporting. It's a very scary situation, right? Because I'm a mom and my daughter is just 9. So I'm like, okay, what's going to happen soon? It's a scary world. The thing that I feel we need to look at is that it's not a one size fits all kind of a thing. Yes, just like alcohol, there are a lot of people who have used cannabis recreationally and who have not suffered any side effects from it. Okay. But there are those who have gotten addicted, who have gotten hooked onto it, and who have suffered from really serious consequences of it, which have impacted not only their mental health, their physical health, but also future courses of their study or their education. So it is very important that this distinction is made. So I have a lot of patients who come in because I work a lot with youth. I have a lot of patients who come in and talk about how cannabis is, healthy and how it's okay to smoke up and everything, and how, when it is legalized everywhere else, why is India still fighting the whole deal and why aren't we getting it legalized yet here? So what I usually tell them is it's not something that everybody can do, right? And if they come with a specific set of symptoms, like it was just last 2 weeks ago, I was on a holiday for the last 10 days. So 2 weeks ago, one of my patients came up to me and he was like, dude, I smoke up every day. I'm like, okay, great, awesome. And then he's like, but you know what? I'm not able to sleep since the last month, and I'm not able to focus on my studies. But I don't think it's because of the weed. I'm like, okay, really? Then what do you think is causing it? So everything else is fine, right? But they are not willing to look at the fact that the weed could be causing the insomnia, or it could be causing the difficulty in focusing.
Yeah.
So I said, see, logically, it looks like this is the only thing, but let's assess and evaluate and see how to go forward. So it is important to see whether or not it is interfering with your functioning, like with any substance, right? If you are able to have a drink socially or smoke socially without it impacting any of your functioning, and you're able to call quits whenever you want to, then it is not dependence, then it is social use.
Yeah.
But when it boils into your day-to-day functioning, and when it impacts your, say, at a student's phase of life, it impacts your studies, or at my state of life where I'm now working and consulting patients, if I turn up stoned to the clinic, it's a problem.
Yeah.
So it should not interfere with your functioning, right? And that's I think one of the biggest criteria that we use to decide whether or not there's a problem, whether or not intervention is required, because otherwise everybody's family would bring them for treatment. That doesn't work like that. It's only when it is impacting socio-occupational functioning that we need to take a call about it.
Yeah, true. Also, I think people who think like today I'm not dependent, so I won't be dependent in the future. You never know. I mean,
Yeah.
genetics play a role, and your personality, the way you function itself. If you're a risk taker, adrenaline junkie, and all of that also definitely plays a role. What are the different psychological issues or symptoms or diseases? Like, what are the things that you see in your day-to-day practice with people coming with cannabis, heavy use or addiction or dependence, whatever?
So, what I often see is that it is started off as a mode of relaxation, a mode of, just chilling with friends. And I felt good. I used to feel very restless, very anxious before. This puts me in a very calm zone and I feel a lot more relaxed and, a lot more comfortable. So that kind of start or the onset effect that people report of. But over a period of time, there is definitely an increase in the depressive symptoms. Sometimes there's an increase in anxiety symptoms. In some patients who have the genetic predisposition, there can be an increase in paranoid thoughts. Like I remember this college student that was consulting me who specifically said that when I smoke up, I start doubting my girlfriend. Otherwise, I'm like really chill with her, but it's only when I smoke up that I start doubting her, and I think that she's cheating on me or she's messing around with other guys behind my back. And I know she's not doing it, but when I'm smoking up, I can't. It doesn't work. Like I just completely get carried away by the thought. So paranoid ideation, and as you know, in patients predisposed to it, it can precipitate a serious condition like schizophrenia or any other psychotic condition. We also look at a lot of anxiety that patients come with, and focus and concentration goes completely for a toss over a period of time. So definitely patients with ADHD already with their difficulty and restlessness and impulse control concerns, with you add weed or tobacco or alcohol to the mixture and it completely messes up with their study skills. So that's another concern. And one thing that I feel, because of its appetite stimulating effect, I think it also interferes with the way the person functions, and makes it a lot more erratic rather than a structured functioning, where they're going for hours sometimes without eating anything and then binging on a lot of food. So that's definitely not a very healthy pattern for their lifestyle. So this is something that I have seen among patients.
Yeah, I mean, even I'm seeing a lot of weight fluctuations. I mean, some people actually start it to gain weight, and then chronic use is causing weight loss. So that's a concern again. Um, uh, People with eating disorders also, can get hooked on to cannabis because they hear two different school of thoughts. Like some people are losing weight, some people are gaining weight. That is one thing. What I'm really seeing is amotivation syndrome. I mean, it's not just in the textbook, but I'm classic patients. They might not have depression. They're not having any other criteria for depression. They're coming with absolutely no will
No
or
motivation.
drive to do anything, even the things that they enjoyed before. I mean, that could be addiction in itself, but I'm definitely seeing they're having memory lapses. They're not able to focus. They're being like thrown out of their jobs, or they're having like poor performance certificates from their health from their agency recruiter. Or this is definitely happening. Again, I think that somebody who is taking substances on a regular basis, their lifestyle itself can be a little dysfunctional. How they form relationships, how they maintain relationships, how is their schooling, how is their employment, everything. I think it creeps into every aspect of their life, even if I don't diagnose them into one specific disease. Definitely. And funny to say that any schizophrenia patient that I'm getting, especially who is in their early 20s of this, what is this generation called? Gen X? No, millennials?
Gen Z now, millennials.
So most of them are having cannabis use. I'm not sure if that is what caused schizophrenia, or I don't know if it's cause or effect. It's always, bidirectional is what we read, right? But the older schizophrenics, I mean, cannabis wasn't so popular back then, right? So not so much. So again, we don't know so much about gene studies, right? We are not there yet where
We
we're
don't
going.
have the data.
Exactly. We're not going and seeing if you have a COMT gene allele dysfunction to see that, you could be developing a cannabis addiction. We don't have the data. So safe to say better to avoid when you know that you can get hooked onto it. Don't be in
And
denial.
when you start seeing concerns, then
Yeah.
it's a better thing to avoid. So that's how I usually tackle patients who come and say that, I'm not addicted to it. And I'm like, okay, you've come to me with certain concerns. Let's explore and see if these concerns are because of cannabis. And that generally makes sense to them because when you're in a private setup, especially like me, like an OPD based setup where I don't really admit patients, um, patient compliance and willingness to quit is a very huge factor. Like if they're not willing to quit, there's nothing I can do. From the OPD, there's not much I can do. So it is important for them to be on the same page as me. And I'm in that sense very flexible with them. I'm like, okay, you take your time. You
Yeah.
want to think about it, explore ideas, come back to me, discuss it 2, 3 more times, and then take a call about the treatment, whatever. But once you decide, then you take a call to quit, and then we will work on it. Especially, see, by the time they reach out to me, they've already either been diagnosed with clinical depression or a psychotic disorder or something interfering with their focus and concentration. So they need help at that point. And there is really no point beating around the bush and saying, okay, we'll see how things go. And, if you want to quit, you can quit. It doesn't work like that. I think it's far better to be upfront and honest with them and tell them that this is what it is. Whenever you're ready, we'll work on it. But until then, no point filling a pot that has a hole in it.
Yeah.
It's just going to leak. So you might as well just wait.
Yeah. Oh yeah, pot is another name.
Oh, yeah, pot is another name. We forgot about pot. Yeah, I don't know how I forgot that. That was such a common name when I was
Such
in
a common
college.
name. Yeah.
Everybody would say pot.
Yeah. Yeah. So, we all know that, nicotine tobacco is a gateway drug. It leads you into the avenue of, or arena of a buffet of option of. But I'm also cannabis becoming a gateway drug. What do you think?
I think there's a very, very serious risk of that because uh, one, it is very easily available. Like
Yeah.
it is so easily available that it's not even funny. That children have access to it, teens have access to it. It's available in schools. Um, a lot of times parents don't even know that the kid is smoking up, and they think it's some weird grass or some weird, you know,
Yeah.
uh, school project related something, and they don't even understand that the child is smoking up. So um, it is something that has slowly gotten so widespread and so easily available across the country that and it's available at very, very low prices. Like
Yeah.
I don't know what the quality of the weed is, but
Yeah.
it's definitely available for very cheap, as cheap as like $20 or 50 rupees, and that's all that is needed to buy you enough to roll like maybe 2 joints. And so I am concerned that once a tolerance to the effect of the weed develops, uh, people might look to exploring stronger drugs, right? So I think it would be easier if there is like an understanding that this could lead to other things. And if I'm using it, I use it in a responsible manner and restrict myself to say maybe socially smoking with a few friends or something like that. But it's very difficult to um, it's very difficult to pinpoint what it could lead to, because
Yeah.
there is an exploration that is going in the direction of meth,
Yeah.
and that's also something that's easily available. Along with it, of course, there are a variety of other options that are available, and it could open up avenues to that as well. Um, something that I've noticed, and I don't know if you've seen the same among your patients, a lot of them are more comfortable smoking tobacco and weed and not having alcohol in like large quantities or a lot of alcohol at all. So alcohol is sort of reducing. It's still there, they still drink, but the focus is more on the weed.
Hmm.
I
Yeah, I
don't know if
mean,
that's something that you've also noticed.
no, I mean, I don't know about patients, but definitely if I'm going to a party, if I'm going to, let's just say, a house party, we have the classic people who just sit and drink, and people who say that I don't drink, I only smoke up. So
Yeah,
there's definitely people who are only sitting in balconies and just rolling joints, and nobody
just
smokes.
rolling joints.
Yeah, I mean,
Absolutely.
those people are very detached from the rest of the people. They're
Yes.
isolated. They just have their own, go on their own trip. So
And they
yeah.
have their own clique of friends with whom
Yeah.
they do that. And
Yeah.
yeah,
And the meeting point is definitely weed. Again, the
yeah.
people who smoke weed are the ones who chill together. That definitely is something that I see. Um, are there any withdrawal symptoms even after like super heavy use?
So I've had patients complaining of extremely disconnected feeling the next day after heavy use, and feeling completely zoned out and very drowsy and out of it for a few hours sometimes afterwards. Uh, Classically, the way we look at withdrawal symptoms is that whenever the use is either reduced or it is, cut off completely, like a cold turkey cut off kind of a thing, that's when the withdrawal symptoms should come. But with weed, what we usually see is people don't, it's very rare that you will find somebody who's smoking up joint after joint after joint every day, you
Yeah.
know. So it'll be like binges of it, probably spread out over the weekend or few days, then for a few days nothing, then again for a few days. So that's typically how they use it. But I've of course had patients who smoke every day as well, and they've told me that when they stop smoking they don't feel that good feeling, that happy feeling that they used to get when they were smoking up. And a lot of times that's what scares them. Like they don't want to go into that zone where they're anxious or depressed or whatever is the primary concern that led them to the smoking up in the first place. They don't want to experience that. So a lot
Yeah.
of it is to make sure that those feelings are at bay.
Yeah. True. True. I mean, I see that as well. I think one of the super interesting and last question about medical marijuana. So I want people to know uh, rolling a joint and smoking is not medical marijuana. It's completely different molecule
Absolutely.
altogether, and it's used for different set of patients and certain indications, and still under research. It's still not out there. What are
Absolutely.
your experiences? I mean, I haven't experienced, but then I have like little like research knowledge. I mean,
Yeah,
what?
yeah. Even I haven't seen or experienced it. So honestly, it was very fascinating to me when I was reading our comprehensive textbook of psychiatry, and when I was reading about the weed part and how there are already receptors in the brain that are for cannabinoids, and how the entire section of endocannabinoids have been created just because of that. I think there is a lot of potential in terms of medical uses for marijuana, but right now in the country that we live in, it is not legal and it is definitely not medically authorized. So for
Yeah,
all those of you who come to me saying, "Doc, will you prescribe some medical marijuana for me?" You're not getting any prescriptions. So not yet, at least.
yeah,
Um, I think medical marijuana, the difference would be that, when you're rolling a joint, you do not know the concentration, the content, the quality, there's no standardization, right? Of course, some of my frequent weed users will disagree and say, "No, ma'am, I can smell the quality of the weed." but but honestly, I haven't. I mean, there's no standard process, obviously, to it. Uh, when we look at anything that is medical, there is a lot of research that goes into it before that particular product is marketed. So while all of you have a lot of concerns about, the medications that are prescribed by psychiatrists, please understand that it comes with 10 years of research or 20 years of research
maybe
sometimes.
more.
Yeah,
Yeah,
with everything, like what effect, what side effect, what will happen if you take it in this dose and then this dose and then this dose. So we know all of that. Of course, even after that, things go wrong.
Yeah.
So imagine how much more it could go wrong with something that is not researched, not standardized, and you don't know anything about. Okay. So the idea is that when it is prescribed medically, it is prescribed in specific doses for specific indications. For example, it can be used as an excellent appetite stimulant for anorexic patients who are going through cancer chemotherapy. Yeah. So there are very specific purposes for which we can use it, and it has to be prescribed by a trained medical professional, because it is something that alters the functioning of your brain. You don't want anything messing with the functioning of your brain. I mean, that organ controls the entirety of your body. So you don't want
Yeah.
anything messing with it, right?
Yeah.
Because you don't know what the impact will be down the line. So I would definitely, recommend that when it comes to it, whenever, we have the option of medical marijuana, go to a proper medical practitioner who can check you, see whether it is suitable for you or not, because it can totally happen that you have a family history of a psychotic disorder, and you are taking weed and it precipitates the disorder, right? So it is important that it is done under the guidance of a trained practitioner. Of course, the recreational weed is nowhere close to this
Yeah.
entire researched medical model that we have. And right now, we don't, you're not even legally allowed to smoke up. So that's a different aspect of the whole thing. Like if
Yeah.
you're
People,
caught
people,
with it,
if
you'll
people are watching
get into
news,
trouble.
if
I beg
people
your
are
pardon?
watching news, if people are watching news, what's happening, right?
Yeah.
Yeah. With like actors and actresses. Yeah.
Absolutely, absolutely. Because I think one of the things is that since it's so freely available, and since it's being used so blatantly, a lot of the times people don't even realize that it's still one of the restricted drugs in our country. Like it's
Yeah.
not something that is like, it's not like alcohol.
Yeah.
So it needs to be, you need to think about the implications of it, right? Like you could have smoked up with friends and you've never been caught, but imagine if you get caught even once,
Yeah.
and it it could turn your life upside down completely, and that's not a risk that you should be taking. So
Yeah.
yeah, so that's the other
Yeah.
bit.
No, this patient told me that he grows his own weed. I asked him, where do you source it from? He says that I don't have to source it. I grow it in my own backyard. I have a beautiful back.
Backyard.
I'm like, okay, wow. I thought only okra and brinjals had grown.
Yeah, there's a
Yeah.
little weed growing among the tomatoes.
I mean, even when I ask, I mean, on a lighter note, right? Even when I ask patients, like, why you're not ever caught by your parents? Like, how did you get till here? So one of these patients told me, like, my mom saw it, and my mom told me, like, I think you put some leaves in your book. I know. It looked like it caught fungus, so I threw them. This kid was
Wow.
like, yeah, like a lot of funny stories is what I hear. I think because parents also are not very aware. A
Yeah.
lot of like most of the Indian parents, I think they're not aware of what weed is, what
Yeah,
cannabis.
yeah, yeah.
They think
Absolutely.
cannabis, weed, marijuana, all are so different. Like they're different drugs altogether.
Absolutely.
Yeah, yeah. I mean, I'm also doing health awareness with a couple of international schools, and they already know a lot about what happens in intoxication. And they're very boldly standing up in front of like 300
Hmm.
students, and they're telling me that once I tried and I lost sense of time. It felt like time just stood, got
Stopped.
stood,
Yeah.
yeah, and stopped, and it was very good and stuff like that. So I was just wondering. These are eighth and ninth class students, so
Yeah.
yeah. I mean, I see your concern as a mother for sure.
Yeah,
I
yeah.
mean,
So the idea is that it is happening, it's there, it's real.
yeah,
We need to do our best in raising our children, and every child is probably going to explore. Not every child will get dependent.
yeah,
So, we need to also understand that. Like everybody tries alcohol at some point of time or the other. Not everybody gets dependent on alcohol. It's a very small percentage of the ones that try that
yeah,
actually get dependent. And there are, like you said, a number of factors that are involved in the dependence process. So, we will need to take it with a pinch of salt and see how things go.
yeah,
Um, I the what I like to tell all my patients who smoke up or who prefer to smoke up is that if it is something that you're doing recreationally, it should be only recreational. Like it shouldn't be something that you're doing on a regular basis or interfering with your work or studies or anything. If it is doing that, then you need to rethink your priorities. Yeah, because on one hand it is weed, on the other hand it's your studies, or on the other hand it's your work. And what is a bigger priority? That usually puts things into perspective for them, especially if they've, like it helps if they see that there is a decline. Like, a bright kid who was getting 90 is now dropping to 70, sees it and is able to tell me that, yeah, ma'am, you're right. I could do 90. Why can't I do it now? So it helps when they see the real consequences of what is happening, and then they can take a call. Because once they make that informed decision, Charan, I feel they'll be clearer about their priorities for the rest of their life, rather than me just telling them, okay, you have to stop it for the next 6 months or a year, or the parents enforcing by checking on their moves. I don't encourage that a lot, unless like we're looking at monitoring the drug use of a patient. I don't encourage parents to snoop and check what's happening in their children's bags and lives and everything. I'm like, give them the space. See, because the minute they grow up and they get out of your house, they have the freedom to do whatever they want. You'd rather they grow into responsible adults than children who are only responsible because you're watching, and the minute you stop watching, they go back to their habits. So that's what I would like to say.
But also, I think, Wilona, what's happening is about priorities, right? If there is a kid whose grades are definitely dropping, but ending up making more friends is reducing his anxiety and having sense of belonging or identity formation with the cult group. I think their priorities already shifted, because that seems more exciting than somebody who's scoring 90 and 80 wouldn't be a problem right now. So what I feel is people need to cope. Like if you're having anxiety, if you have social anxiety, to meet people and to mingle in groups, performance anxiety, I think they should come and see a professional and take help for the social anxiety rather than coping it with a substance.
Absolutely, because what happens is when you're using a substance, one, you don't know how long the effects will last and what will be the side effects. And second, that's a temporary solution, which means that every time you're in a socially awkward situation or an anxiety-provoking situation, you will have to smoke up or drink again, which doesn't make sense, right? So you'd rather develop strategies to deal with the anxiety in a healthier manner. I think that would be the best.
True.
Yeah.
I think that's our time, Wilona. Thank you so much. This is fun.
Yes, it was fun. Thank you so much.
Thank you so much for being on it. I'll see you soon. Take care of yourself.
I'll see you soon. Take care. Bye.
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 So I hope all of you learned a thing or two about cannabis. Definitely go back and watch it again if you think you didn't start watching us from the beginning. So you'll understand how the talk went and what's the flow of the talk and how we discussed about various aspects of using a drug use, something like cannabis. So next Wednesday, I won't be doing a talk because I'll be out of station. Also, I'm having a busy schedule. So I'll see you in the December 1st Wednesday. Till then, all of you stay safe and take care of